Did you know that one of the most powerful natural medicines might already be sitting in your kitchen? Yes, garlic. Garlic, Allium sativum, is indeed one of the most well-studied and historically revered natural remedies, often called a powerful medicinal plant for good reason. For thousands of years, people around the world have used garlic not just as food, but as a natural medicine for healing and protection. From supporting the heart to fighting infections, this small plant has earned a powerful reputation. Garlic is a bulbous plant in the Allium family, related to onions, leeks, and chives, native to Central Asia, and now grown globally. The medicinal magic happens when you crush or chop the cloves. An enzyme converts alliin into allicin, the main sulfur compound behind garlic's pungent aroma and many bioactive effects. Other key players include additional sulfur compounds, like ajoene and S-allyl cysteine, selenium, vitamins A, B, C, E, and antioxidants. These compounds contribute to garlic's antioxidant, anti-inflammatory, antimicrobial, and cardiovascular-supporting properties. Evidence-based health benefits. Scientific research, including meta-analyses and clinical trials from sources like the Linus Pauling Institute, NCBI PMC reviews, and recent studies up to 2025-2026, backs several benefits. Heart health and cardiovascular support. This is one of the strongest areas of evidence. Garlic can modestly lower blood pressure, especially in people with hypertension, reduce total and LDL, bad cholesterol, improve lipid profiles, and inhibit platelet aggregation, reducing clot risk. Meta-analyses show reductions in blood pressure and lipids, with benefits more pronounced in those with elevated levels. It may also support endothelial function and reduce atherosclerosis risk factors, though long-term prevention of heart events isn't fully proven. Fighting infections. Garlic has well-documented antibacterial, antifungal, and antiviral properties in lab and some human studies. It's been used traditionally for respiratory issues, colds, and flu. Some trials suggest it may reduce cold or flu severity or duration, thanks to allicin and other compounds. Historical use during World War I for wound disinfection aligns with its antimicrobial effects. Digestive health. Garlic supports gut health by promoting beneficial bacteria, combating harmful ones, and potentially helping with parasites, as in traditional uses for worms. Evidence is supportive but less robust than for cardiovascular effects. Reduction in risk of cancer. Traditional claims are strong, and lab and animal studies show garlic compounds can inhibit cancer cell growth, support detoxification, and reduce inflammation. Epidemiological data links higher garlic intake, especially raw or cooked, to lower risks of certain cancers like stomach and colorectal. For example, some meta-analyses show 25 to 35% risk reduction in high consumers. However, recent reviews and meta-analyses find inconsistent or no strong association overall for cancer prevention in humans, particularly from supplements, and evidence doesn't support it as a treatment. Other areas like antioxidant effects, immune support, and metabolic benefits, e.g. blood sugar regulation in some studies, show promise, often from aged garlic extract or raw forms. How to use garlic for maximum benefit. To activate allicin, crush or chop fresh garlic and let it sit 10 to 15 minutes before cooking or eating. Forms include fresh cloves, most potent for allicin, cooked in meals. Supplements, e.g. aged garlic extract for odorless options, look for standardized allicin potential. Raw or minimally processed tends to offer stronger effects in studies. Safety and precautions. Garlic is safe for most people in food amounts and generally well tolerated. Common side effects include bad breath, heartburn, gas, or digestive upset, worse with raw or large doses. Key caution: garlic has blood-thinning effects, so high doses or supplements may increase bleeding risk, especially if you're on anticoagulants, e.g. warfarin, aspirin, clopidogrel, or antiplatelets. Consult a doctor before adding supplements if you're on these meds, have bleeding disorders, or are preparing for surgery. Stop supplements 1 to 2 weeks prior. It's usually fine in culinary amounts. In summary, garlic isn't a miracle cure, but it's far more than just flavor. Evidence supports its role in supporting heart health, fighting infections, and providing antioxidant benefits as part of a healthy diet. Your script nails the essence. Sometimes the most powerful remedies are simple and natural. Adding a clove or two to meals is an easy, evidence-backed way to harness its power. If you're dealing with specific health conditions, chat with a healthcare provider to tailor it safely.